Hello, my name is Jeannie Nassauer. I'm a physician assistant here at UCSD with the cardiology department, and we're going to look at some EKGs today. The first one we're going to look at is a normal EKG, and then we're going to go over an example of a heart failure patient. So first thing you want to look at with an EKG is we want to look at the rhythm. We want to look for a P wave in front of every QRS complex, which you see here. And you see, if you take your calipers and notice normal rate, regular RR intervals, so we know the patient is in sinus. Other things you want to note is the access. Typically, we look for normal access, and you can do that by looking at the leads, R wave in 1 and AVF. They're both upright, and AVL as well, and lead 2, so you know you have a normal access of the heart function. Then other things you want to look at is your T waves. So you notice the T waves are all upright and all the leads there. And additionally, you want to look at your QRS complex and make sure it's not widened and have an abnormal or over 12 seconds. Let's see. So that's basically what we want to look at there for a normal EKG. Now let's take a look at this heart failure patient. This is a gentleman with a depressed EF and some structural abnormalities consistent with having heart failure. So the first thing you look at, as we would with any EKG, is the rhythm. And so we do notice here a P wave in front of every QRS complex. So we note he is in sinus rhythm. We can see based on his RR interval that it is regular. But in that, we will note that he is tachycardic, which is a typical finding with heart failure. They have a low cardiac output, so typically they'll be tachycardic in order to compensate for that. Now if you look over here, this gentleman does have a normal access, but then we take a look at the P wave. So we notice the P wave here is very enlarged, and then also we have a inverted. Typically you would expect a biphasic T wave for left atrial enlargement, but this is quite inverted, letting us know that he has a big atrium. Then you want to notice the R waves in these leads. He has poor R wave progression, but he also has a very large R wave in V3 and V2, which is typical of LV enlargement, which you would expect with heart failure. And then his T waves are inverted, which is abnormal, and that is consistent with an LV strain pattern consistent with heart failure as well. So those are some of the typical findings you would see and expect. We don't see any abnormal ectopic beats such as a PVC or a PAC, but these are consistent with someone with a low EF.
Yay!